welcome to Activate Sports Therapy's first ever YouTube video. Today I want to talk about an ACL injury, anterior cruciate ligament injury, and how your ankle range of motion can reduce the risk of hurting the ACL and hopefully prevent you from ever snapping it. The ACL comes from the back of the tibia, attaches to the front of the femur. It's in massive stress, it goes under massive stress when the femur rotates medially or towards the other leg. This happens when you're running or landing or jumping, whatever scenario it is, that the foot hits the floor. And as it hits the floor, the knee wants to go past the toes. If for whatever reason there's a block, for example this one, it can't go any further, it stops. The knee has to go somewhere else, so it goes inwards. And this happens. The knee falls inwards, the femur rotates, and that's when the massive stress gets placed upon it. Doing it once or twice is fine, but after repeated incidents, so a long distance run from someone who continually does this, eventually the ACL gets weaker and weaker and weaker until a point where it's very prone to snapping, which of course you don't want because you'll be out for roughly 18 months to 2 years. So today I'm going to show you a test looking at ankle dorsiflexion. That's when you land, that's when the knee goes towards the toes. That's the range of motion you want to look at. The bigger that range of motion is, the more time the body has to disperse the energy absorbed from landing. A bit scientific, but we'll keep it simple in the test. The knee to wall test starts with one foot touching the wall. Then you bend your knee to touch that same wall with your heel flat on the floor. Once you've done that, move your foot backwards and again touch the knee to the wall. Keep going until you've gone as far as you can, making sure your heel is on the floor every time the knee touches the wall. Make a note of that maximum distance and repeat the whole process on your other foot. Once that's got to its maximum distance, again make a note of the distance and compare side to side.